So being in a hospital is really different than being in a clinic. In the inpatient setting, your patients are very, very sick and they need you to be, on top of their case 24/7. Now, of course, part of the challenge and the interesting part of that is you've got to transition care every 12 hours or so when the new night resident comes on, and then you get sign up from them in the morning as to how your patient did overnight. It's pretty interesting because you can see one pathology really play out and really respond to your treatment, or really kind of change presentation so you suddenly know what you're looking for. Outpatient is a little bit different. You're not seeing your patient as long, they're not monitored like that. So you have to go by their accounts of what's happening, and you kind of have to understand what they're trying to tell you. You have to be able to ask questions in a way that you can elicit the answers to these questions that you would otherwise have answered just by looking at them multiple times a day. Now, of course, they're usually not as sick, so you've got a little more time to play with, but it's quite a balancing act to decide, okay, this person is not sick enough to need a hospital. I need to be able to follow them in a clinic setting. But the nice thing is there that I don't discharge them from clinic like I discharge them from hospital. When they leave the hospital, I might not get to follow up with them. I might not get to see them in 6 months and see if anything I did made a difference. In the outpatient setting, you get to see that. You get to see your patient progress from, day 0 to day 360. And it's amazing the difference you can make. It's amazing the difference the patient can make for themselves once they finally have a provider that they feel like cares for them, that they feel like they can call and talk to. One of the interesting things about residency is that often my patients that are in the outpatient clinic are patients that I saw here in the hospital first. So I can see them when they're kind of at their worst in the hospital, we get them better, and then a week or so later they come to clinic and it's a totally different person. They're not wearing a hospital gown, they're not acutely ill, they're going about leading their lives and making the changes that we had talked about in the hospital, and that's really, really rewarding.